Hello and welcome. Today we're diving deep into a fascinating, yet complex, connection between a seemingly liver-centric disease and kidney health, hepatitis B-associated nephropathy. We'll explore what it is, why it happens, and what can be done about it. Hepatitis B-associated nephropathy is, as the name suggests, kidney disease directly linked to chronic hepatitis B virus infection. The key here is chronic infection. It's not the acute, short-term infection that usually leads to kidney issues. Instead, it's the long-term presence of the hepatitis B virus in the body that triggers a series of events leading to kidney damage. So, how does a virus primarily affecting the liver cause kidney problems? The pathophysiology is complex and involves immune complex deposition. The hepatitis stimulates the body to produce antibodies against it. These antibodies then bind to hepatitis B viral antigens, forming what are called immune complexes. These complexes circulate in the bloodstream and, critically, can get trapped in the glomeruli of the kidneys. The glomeruli are the tiny filtering units within the kidneys. Once deposited, these immune complexes trigger an inflammatory response. This inflammation damages the glomeruli, leading to proteinuria, protein in the urine, and potentially impaired kidney function. Different types of these immune complexes are usually deposited depending on the type of nephropathy. Hepatitis B infection is a global health concern, and consequently hepatitis B-associated nephropathy is also seen worldwide. Its prevalence is highest in regions where hepatitis B infection is endemic, such as parts of Asia and Africa. While anyone with chronic hepatitis B can develop this nephropathy, it's more common in children than adults, especially in endemic areas. However, with global migration patterns, it's important to recognize that this condition can occur in individuals from any part of the world. The signs and symptoms of hepatitis B-associated nephropathy can be subtle at first, making early detection challenging. Often the first indication is proteinuria, which may be detected during a routine urine test. As the kidney damage progresses, individuals may experience edema or swelling, particularly in the legs, ankles, and around the eyes. Fatigue due to impaired kidney function can also be a common symptom. In more advanced cases, signs of kidney failure may appear, such as nausea, vomiting, loss of appetite, and changes in urination patterns. Diagnosis typically involves a combination of blood tests, urine tests, and sometimes a kidney biopsy. Blood tests help assess liver function and confirm the presence of chronic hepatitis B infection. Urine tests will reveal proteinuria and may also detect other abnormalities. A kidney biopsy, where a small sample of kidney tissue is examined under a microscope, is often necessary to confirm the diagnosis, determine the specific type of nephropathy, and assess the extent of kidney damage. Immunofluorescence staining can help in confirming the presence of immune complex deposition. While various types of kidney disease can be associated with hepatitis B, membranous nephropathy is the most common. Membranous nephropathy is characterized by thickening of the glomerular basement membrane due to the deposition of immune complexes. Other less frequent types include membranoproliferative glomerulonephritis and focal segmental glomerulosclerosis. Each type has a slightly different pattern of immune complex deposition and glomerular damage. Treatment focuses on two main goals: controlling the hepatitis B virus infection and managing the kidney disease. Antiviral medications, such as interferon or nucleoside analogs, are used to suppress viral replication and reduce liver inflammation, which can indirectly benefit the kidneys. Immunosuppressant medications, such as corticosteroids or other agents, may be prescribed to reduce the inflammation in the kidneys caused by the immune complex deposition. Supportive care, including blood pressure control, dietary modifications to reduce protein intake, and diuretics to manage edema is also crucial. The most effective way to prevent hepatitis B-associated nephropathy is through vaccination against hepatitis B. Universal vaccination programs, especially for infants, have significantly reduced the incidence of hepatitis B infection and, consequently, the risk of associated complications, including nephropathy. Avoiding risk factors for hepatitis B infection, such as sharing needles or unprotected sexual contact, is also essential. The prognosis for hepatitis B-associated nephropathy varies depending on several factors, including the severity of the kidney damage at the time of diagnosis, the effectiveness of antiviral therapy, and the individual's overall health. Early diagnosis and treatment can improve outcomes and potentially prevent progression to end-stage renal disease, requiring dialysis or kidney transplantation. Recent research is exploring novel therapeutic targets, such as specific molecules involved in the immune complex deposition pathway, to develop more effective and targeted treatments. Additionally, ongoing studies are investigating the long-term effects of antiviral therapy on kidney function in individuals with hepatitis B-associated nephropathy.